And tēnā koutou katoa, ko Kanchana Subedi tōku ingoa. We did some detailed analysis for some of the specific groups that we are interested in. So I'll be talking about some of the key findings from the 3 thematic reports that we produced based on Just Sayin 2021 responses and some in-depth interviews with young people who responded to the Just Sayin survey. So the 3 groups that we looked into, one of the groups included young people from rainbow communities. And we use the term rainbow in our report to indicate the umbrella, used as an umbrella term to indicate minority genders and sexual identities. There were 63 young people in the survey who identified themselves as part of rainbow communities. And this report includes analysis of responses from these 63 young people. The second group that we were interested in were young people who were in youth justice residences at the time of Just Sayin 2021. There were 24 young people in this group responding to Just Sayin 2021. We did some in-depth interviews with 17 young people and some staff members as well, an equal number of staff members, and synthesized findings from these data sources in the form of a thematic report. The third group that we looked into were Rangatai, Maori and Pacific young people. In the Just Sayin 2021 responses, there were 201 responses from Rangatai Maori and 44 from Pacific young people. We further interviewed 17 young people from this group and synthesized findings in the third thematic report. Paris spoke some of the things about Rangatai Maori and Pacific young people's needs and how they are doing. So I won't go into a lot of details for this group, but we'll talk some of the findings from the report. Before I go into the details for these specific groups, I'd like to acknowledge the work that Malatist research team, including the Pacific research team and Maori research team, in carrying out this research and analyzing information for us to be able to understand the needs of young people transitioning out of Oranga Tamariki care as we seek to provide better services for this group of young people. To the transition needs of rainbow young people. In Just Sayin 2021, we included a question that asks whether young people identified themselves as part of rainbow communities. And by rainbow community, we mean all young people within the minority genders and sexual identities, including lesbian, gay, bisexual, pansexual, queer, asexual, transgender, takatapui, whāwhāwhine, non-binary, genderqueer, and other identities. So it's an inclusive group, and a commonly used term, rainbow, is used in the report. For young people who are not part of the rainbow community, we've used the term trans homosexual young people. Sorry, cis heterosexual young people. In our research, we found quite a lot of young people who identified themselves as rainbow young people. There were 19% of the 331 who responded to the survey and identified themselves as part of this community. In general, there were lots of areas in their transition from Oranga Tamariki care where they said they were doing okay. Like, for example, there were about 67% of young people in this group who said their health needs were being met, an equal proportion of young people who thought their life was excellent. And this was actually more than the cis heterosexual young people responding to the survey. In terms of schooling and work, there were a lot of young people, 87% of young people from this group who were in some form of schooling and or work. They also reported that they were generally doing okay with their housing experience, and they were positive about their housing experience and were proud of their identity. The chart shows that in this group of young people, there are more proportion of female rainbow young people who responded to the survey compared to male young people. which is consistent with research from international sources. There were also areas where young people were not doing that well. Young people in this particular group were not doing well. For example, disability. 73% of young people reported they had a form of disability, and disability was measured using Washington Group short scale. Rainbow young people were also less positive about their overall well-being based on the 4 domains of Tipari Tapafa. And most notably, they were not doing that well in their mental well-being. Like as the slide shows, there were 54% young people who self-assessed their mental well-being or taha hinengaro as poor or fair. And the difference we found was statistically significant as well. There were some other areas as well which I haven't included in the slide and are included in the report where rainbow young people were not doing okay. Like for example, 38% of this group of young people who responded to the survey said that in the last 12 months there were at least one occasion where they wanted to see a healthcare professional or provider but were unable to do so. And the barriers included, as Paris mentioned in her slideshow, some of the individual circumstances, including transport or financial issues or anxiety issues. Overall, based on the report for this group of young people, we take on board the learning that rainbow young people needs to be a part of the focus in our disability work program. Oranga Tamariki has a program of work looking into disability and complex needs of Oranga Tamariki cohort, and that includes 40% of the transition cohort. We also see that young people, rainbow young people, need to be ensured to have access to support from social workers and transition workers who can actually understand the needs, additional needs of this group of young people, and ideally be part of the rainbow community themselves to be able to provide support that this group of young people needs. I'll move on to the second group of young people that we looked into details, which is the young people who were in one of the 4 youth justice facilities at the time of Just Sayin 2021. Just to note that this group of young people, or the report, does not include those young people who may have had past experience of youth justice facilities. So only includes those 24 young people from Just Sayin 2021 who were in the residence at the time of the survey, plus additional interviews with 17 young people and others, and similar numbers of staff members in those residences. Overall, this thematic report again highlights the long history of care experiences and complex needs of this group of young people. Nearly 50% of Rangatai in this group was supported by whānau and wanted to go back to their whānau where they lived after their time in their youth justice residence. A lot of people said that they had nowhere to go after leaving the youth justice residence. And there were several factors or complex situations leading to having young people not knowing where to go after their time in the youth justice residence. For example, there were uncertainties in relation to when the young people will be leaving the youth justice residence, which made it harder for young people to plan where they were going. For some young people, they did not want to go back to their previous caregivers, for example, or the undesirable living arrangements, which meant that they didn't know where they would be going and or where they would be living after their time in the youth justice residence they were at. There were also uncertainties in terms of where they will go after their discharge, because they could be discharged in another location or reason after being released from the youth justice residence. There were also complexities in terms of leaving youth justice residence versus leaving the youth justice system altogether. So leaving the residence does not mean leaving the whole youth justice system altogether. So there were complexities added by that as well. However, in terms of the support being provided by transition support services, the report highlights some positive feedback about young people in terms of the support they get from transition support services. Like, for example, 63% of young people had a transition worker, despite the additional challenges of linking a transition worker to this group of young people. There were 74% young people who had talked to someone about a plan for leaving the residence, and 22% of young people in this group had a copy of their plan with them. Though I have to say that in terms of the plan, young people were not all young people were entirely sure about what plan they were talking about, whether it's a plan about leaving the youth justice facility and their integration into the community, or is it a plan for their transition into their adulthood? A lot of young people in the interviews also talked about, being listened to, whereas others felt that they were not being listened to, so their voices did not matter. But for those Rangatahi who felt their voices were being heard during the planning process, were more likely to engage in their plans and have their plans reflected in their goals as well. The report highlights what young people want in terms of practical skills, which Paris also spoke about, and that included driving, budgeting, and they wanted work in the field of construction or wanted to be mechanics, for example. So the trade-related areas. For some Rangatahi, youth justice experience was seen as positive. Their time in the residence had provided them opportunities to reconnect with education and to change their lives altogether. I've included a quote from one of the young people in one of the youth justice residences in an interview, which speaks a lot about how they feel about their time there in the residence. Overall, we see this group of young people have complex needs, and being in a youth justice residence adds to the complexity into the transition process. Some of the reasons are the ones that I spoke about in the earlier slide. We also found that there was a confusion about roles and responsibilities of youth justice and transition workers. We have taken this finding on board and already started work in terms of clarifying roles and responsibilities of transition workers and produce new resources that better explain our transition obligations and the role of transition workers. We are also making sure that the frontline Kaimahi get the training on the new resources, which will be rolled out in early May. As we can see, the report highlights the need for intensive support for this group of young people and to cater for their needs. And that also includes providing safe and stable accommodation, which Paris had highlighted in the earlier presentation. Providing safe and stable accommodation is a challenge across the transition population. And Oranga Tamariki has been working with other agencies through the Oranga Tamariki Action Plan to increase access to suitable accommodation options for those young people who are living care and youth justice. For this group of young people, the support people, including social workers and transition workers, may need additional skills. And particularly if we see the example about the group of young people who reported some form of disability, there were 50% of young people from this group who reported some form of disability. So definitely transition workers who can actually work with this group of young people and can make sure that support is provided by accessing specialist services is what is needed for this group of young people. There are quite a lot more findings in the reports, but I'll just stop it here for this group of young people and move on to Rangatai, Maori and Pacific young people and understanding their transition needs. For this group of young people, we found that the challenging and complex lived realities is always with them. And in the interviews, they highlighted these complex issues that they have during their time in Oranga Tamariki and after they leave the Oranga Tamariki care as well. The quote from one of the interviews explains a lot about how they feel about their situation and the issues they face. For this group of young people, we also learned from the report that there is a high level of disengagement from education. 42% of Rangatai Maori and a similar proportion, a little bit more than Rangatai Maori, that's 48% Pacific young people were in education and training, which is quite low compared to all other ethnic groups, which sits at 61%. This group of young people also had complex health and social needs, and they needed more support during the transition. Like, for example, 26% Rangatai Maori and 27% Pacific young people self-identified challenges within 2 or more disability categories. And among them, only 50% were receiving this health support they needed. Now, in terms of transition support services and the support they were receiving, we have very, very positive feedback, in fact, from young people. And the support they were receiving, young people saw that as being invaluable in supporting them across multiple domains of their lives. Quite a high proportion of Rangatai Maori and Pacific young people said that they felt that they had a say in important decisions about their lives. A lot of people also spoke about reconnecting with families, and especially with siblings. The reconnection was seen as an integral part of the healing for these young people. And many young people, both Rangatai Maori and Pacific young people, felt that they had as many chances as they wanted to connect with their whakapapa whānau. And the figures from the report sits at 70% for Rangatai Maori and 84% for Pacific young people. From next week, we are doing the Just Sayin survey, and the survey will go live on the 2nd of May. The information about Just Sayin 3 and encouraging young people to participate in the upcoming survey is very important, and we'd definitely like to increase the number of respondents participating in the survey. The target group for the survey, as for Just Sayin 2, includes Rangatahi who are eligible for a transition worker and who have been in care and custody, Oranga Tamariki care and custody. A key feature of this survey is that the responses from young people will be anonymous. Oranga Tamariki will not know who responded to the survey and who did not. For Just Sayin 3, as with Just Sayin 2, we have 3 different groups of young people participating in the survey. One is Rangatahi who are still in care, who we meaning Oranga Tamariki have contact details for. Rangatahi can complete the survey online based on the link that they receive from Malatist. They can also complete the survey via a dedicated 0800 number, and they can complete the survey with an interviewer from Malatist, or they can do face-to-face completion of the survey with the help of an interviewer. The second group that is eligible for the survey is Rangatahi who have left care and who we may have contact details for. For this group of Rangatahi, we are trying to send information about the survey to transition support services partners, transition workers, care partners, and carers. So Oranga Tamariki have been communicating with these different groups to make sure that they are aware of the survey, and they encourage young people to respond to the survey. We also encourage caregivers and request them to pass information to Rangatahi. The transition support services partners are requested to actively promote the survey using their preferred channels. The third group of eligible young people includes Rangatahi with no contact details, and they are not supported by a transition worker. And this is the group that we didn't hear much from in the last round. We definitely want to increase responses from this group. To a large extent, we rely on organizations such as Voice to help young people encourage to participate in the survey. Like in the last round, we had very positive feedback from young people, particularly in the youth justice residents, on Voice. And almost all of the young people who took part in the survey said that they know Voice, they've heard about Voice, and almost 3/4 of them knew how to contact Voice. So we definitely would like to get help from Voice and similar organizations who may be participating in this webinar. And just a note that young people will be receiving co-half of completing the survey, which might encourage them to participate in the survey. So that's about Just Saying 3, Just Saying 2, and then Just Saying 3. I just wanted to note that Just Saying is just one component of the overall evaluation of the transition support services. Other streams of work that Malatist is doing is regional case studies. Regional case studies are underway in 4 different locations: Auckland, Christchurch, Bay of Plenty, and West Coast and Nelson Marlborough region. And we are hoping to understand more in terms of transitional needs of specific priority groups that we talked about earlier. We would also like to know the interface between Oranga Tamariki and transition support partners and the transition support being provided to young people. We are hoping that Malatist will be able to do some data analysis based on anonymized client-level data provided by some transition support services partners. The Evidence Centre, we are also scoping a quantitative analysis to assess early outcomes from transition support services. So we'll be using data from IDI and looking into some of the early indicators in terms of education, health, employment, for example, or justice, to understand how the TSS is doing and what outcomes are we seeing. We have quite a lot of information about young people so far. Not full information, but a lot of information. And in November last year, we prepared a synthesis of findings based on data we've got so far. And the report is available on the Oranga Tamariki website. I just thought I would include some of the key highlights from the report, which shows that the transition support services has been established in different locations. The TSS is providing support to young people that match their needs, for example, life skills or becoming independent, helping them to obtain ID documents, for example, goal setting and help with work, and encouraging them in education and training. We are still early to be able to say anything in terms of outcomes from TSS, but there are promising indications that TSS has improved outcomes for young people leaving care. A lot of young people, as we saw both in Paris's presentation and my presentation, that they were very positive about the support they are receiving from transition support services and transition workers. The report also highlights some of the issues that are still in the process of improving. For example, pre-transition planning was not yet consistent, and there were variations in practice noted. And there are quite a lot of other findings in the report. I would encourage you all to go onto the Oranga Tamariki website and read the whole set of reports, including the synthesis report, Just Saying summary report, and thematic reports supported by other fact sheets that are part of the Transition Support Services evaluation. If you've got any question in terms of the research that we conduct as part of the Evidence Centre, please visit the website, Oranga Tamariki website, and into the research page. If you've got any question on those researches, please feel free to email us on research@ot.govt.nz.